Make a few little adjustments here. Hello, hello, hello. Hi, everyone. Coming to you on another Saturday morning. This is Dr. Vanga, your board certified OBGYN. Hi, Fisho. Welcome and thank you. I'm going to give, as usual, I'm going to give a few minutes to let more people join in. It's about that time, that is true. All right. Welcome to another Saturday. Today is an OB topic, an obstetrics topic. Last week we had a gynecologic topic. Hi, Caroline. We had a gynecologic topic last week. We talked about family planning, basically, and various contraception options. Go call the girls for sure. Coach, welcome. Thanks for being here. Today we're going to talk about how to stay healthy during pregnancy. Again, this is a topic that one of you suggested, so thank you very much, Masola, for that suggestion. I did get a few questions that were in that vein as well, so I thought it was suitable for this week. We have talked about some of the difficulties that can arise in trying to get pregnant, especially in the mature years. So now we want to talk about the process of getting pregnant, staying healthy while you get before you get pregnant and during the course of the pregnancy. So I'll give a few more minutes for a few more people to join in. I can't believe this is the 6th session so far. I can't count on one hand anymore. I'm on the second hand. So thank you for all of you who have tuned in every week to listen in for the questions. And I'm just gratified that you find this to be empowering in some way, as that's my mission. So, hi, Alberta. Hi, Mrs. Lamte. Okay, so I think I'll go ahead and get started. I'm sure people are pretty used to me starting around 11:30. So as people join in, I do encourage you, if you're here, go ahead and just type in a hi or hello or wave or something, just so that I know you're here. I like to acknowledge everybody that makes it every week. And if you're watching this on replay, if you're not able to join us live and you watch this on replay, if you don't mind typing in #replay in the comment field, then I'm able to thank you. Okay. So I'll introduce myself for those who are joining us for the first time. I am Dr. Banga. I'm your board certified osteopathic OBGYN. And every week I've been coming to you with alternating obstetrics and gynecologic topics. This week is an obstetrics topic. My mission is to demystify myths about the female body so that it empowers you when you're making healthcare decisions, so you can make them with more confidence. And I believe by doing so, when you're able to make these decisions with the knowledge base underlying, it helps both you make more informed decisions about your healthcare, about the healthcare of the women in your lives, for the men that are here with us, and for your daughters. And by doing so, it's empowering and it helps you find your voice. So that's my mission, and that's why I do this. Okay. Hi, Kwame, as usual. Hi, Katie. Okay. So today's topic again is healthy pregnancies. I looked up some statistics, given that a lot of you are joining us not necessarily from here in the United States. There are a lot of you joining from the UK and also from different parts in Africa. So it was interesting to me. In the United States, unplanned pregnancies are about 45% of pregnancies. Same for the UK. The numbers came up to be about 45% of pregnancies were unplanned. It was a little lower in Africa. In sub-Saharan Africa, the number was about 23%. Specifically in Ghana, it was 37%. So these seem pretty high, but none of them is over 50%. So what I take away from that, I'm a cup half full type of person, is that more than 50% of pregnancies are planned. Now, obviously, if you get pregnant and it was unplanned, some of the things that I'll start talking about that you're supposed to do before you get pregnant, you've kind of already missed the ball on that. It doesn't mean that's the end of the road there. There's still a lot of things you can do during pregnancy, but this will probably pertain, the beginning part of this lecture will probably pertain more to people who plan their pregnancy. So once, and again, more than 50% of people actually plan it and get pregnant. So once you make the decision to go ahead and start trying to have a baby, there are a couple of things that you want to put into place to make sure that you have a unstressful pregnancy and postpartum period. I won't focus too much on postpartum today. That'll be another lecture because that's a lecture all in itself. And I already have a great feedback from you about talking about that. It's a very important topic that I definitely want to address. So once you make the decision to go ahead and get pregnant, ideally you want to start putting things into place at least 3 months in advance. Depending on what your baseline health status is, you may need more time, and some people don't need as much time. You have to be honest with yourself about what your health status is. If you're in pretty good health, you're not on any medications, you don't have any chronic medical issues, you're in a very good place mentally and physically, and have a great support system around you, then you are miles ahead of, the game, and you have a lot of tools in place to have a successful pregnancy. If you don't, then these are areas that we want to focus on. If there are any health conditions that you are going through, then you want to start having the conversation either with your primary care doctor, your OBGYN, your endocrinologist, your cardiologist, whoever, the pulmonologist, the specialist that is helping you with that particular condition, because you want to make sure that you are transitioning. You want to know what the outcomes can be during pregnancy with those conditions. You want to know the medications that you're on, if they're safe for pregnancy, and if there are certain goals that you need to meet before. For example, if you are overweight, you want to try and see if you can start working towards a more equitable BMI. And a BMI, for those of you who don't know, is a chart that lists out your height and what your ideal weight should be. And you can Google this. I mean, there's so many different BMI charts online that you can look at and determine what your ideal weight is. You don't have to make it all the way into the ideal range. Losing just 10% of your weight, if you are above the ideal BMI range, can already give you a huge advantage during the course of the pregnancy. I mentioned cardiologist. There are people who have underlying heart conditions and diseases, and in pregnancy, your body is going to gain about 50% more body fluid. So this is possibly going to put a little more strain on your heart. So if you already have an underlying heart condition, you want to make sure that it's in the best possible health that it can be to maintain the pregnancy. High blood pressure, that puts a lot of strain on your heart. It puts a lot of strain on your kidneys. So cutting out salt, starting to exercise. Exercise doesn't have to be horribly strenuous. I have people in here who are CrossFitters, and are great at doing high intensity exercises, but there are others who walk for 30 minutes a day, and that is good aerobic exercise as well. So starting out with a good regimen that you can maintain during the pregnancy. I'm not a strong proponent of anyone starting brand new regimens during a pregnancy, especially if it's high intensity. All right, so planned pregnancies, more than 50% plan their pregnancy. We want to make sure that any underlying chronic conditions that we have, we're able to talk to our specialists to talk about getting in better condition, making sure that our medications are transitioned into medications that'll be safe during the pregnancy. And vaccinations are another one. Making sure that your vaccinations are up to date. A lot of times, if you get a viral illness, and given that we're dealing with COVID right now, it's on top of everybody's minds. But if you're exposed to any viral conditions during the course of a pregnancy, it can not just have adverse effects for you, but it can have adverse effects for your baby. Luckily, there are a lot of conditions that we have vaccinations for. So if you're able to make sure that your vaccinations are up to date, that would probably be helpful, not just for you, but also for the health of your baby. Some vaccinations that come to mind would be your Tdap vaccination, which you also get during the course of the pregnancy. Around 27 weeks of pregnancy, you should get a Tdap vaccination. And Tdap stands for tetanus, diphtheria, and pertussis, whooping cough. You should also get one after the delivery as well. Rubella is one that ideally you should be immune for. If you're not, that's one that's a live vaccine, so you can't get that during the course of the pregnancy. You want to get it before you get pregnant. And you don't want to get a live vaccination more than 30 days before a pregnancy. So you want to start the course prior to that, which is why I said that sometimes you have to start at least 3 months in advance. Hepatitis B and hepatitis C. You want to make sure you have immunity to that. Varicella or chickenpox as well is another one. And rubella, varicella, hepatitis B and C, we do check for your immunity during the course of the pregnancy. The problem is if you're not immune, you can't get the vaccination while you're pregnant. So you just have to stay away from possible contacts. But that's something you can talk to your doctor about prior to getting pregnant once you start the decision. Hi, Kiki. Hi, Mommy. Okay, so let's see. I have a few little notes here, so I may look down a little bit just to make sure that I don't miss anything, because this is an important topic. Let's see. Travel. If you have plans for traveling around the time that you're starting to get pregnant, not too long ago, it seems like in the distant past, but not too long ago, Zika was everywhere. And Zika is still around in certain areas. So if you're planning any travel, you can, let me put my little premise here. I believe in the CDC, okay? So I will still recommend going to the CDC website to look for travel advisories for areas that are still high in Zika. And you have to take this into consideration, because even if it's not you traveling, if it's your partner that's traveling, there are studies that show that if a man is exposed to an environment where there's high Zika, that can be transmitted through the sperm as well. So you may have to wait 6 months before you start trying to get pregnant, or 3 months. So looking up that information ahead of time will help in your planning as well. And if you plan on traveling during the course of the pregnancy, if there's travel that would be expected for work and whatnot, having these conversations with your employer, which is the next one that I come to. Making sure that you have structures in place to help assist you during the pregnancy so that you're not dealing with them in the moment of it. So if you have a job that has certain high demands on you, having a realistic goal expectation for that year for things that you will be able to achieve. You know, if it's a job that's going to require you to travel every 2 weeks back and forth, you have to know that you don't know how your body's going to respond to the pregnancy. So do you want to maybe not take that particular assignment and maybe do something different, or have some realistic conversations with your employer about how they'll be able to support you to do some remote events maybe. Okay. All right, I see more people are joining. Hi, Christy. Hi, Janet. Hi, Susan. All right, I'll recap real quick. We're talking about healthy pregnancies, and we're talking a little bit about some of the things you can put into place before you get pregnant. I mentioned some statistics that show that more than 50% of people have planned pregnancies. So there's a lot of things you can do prior to getting pregnant to make sure that you're in the best health. All right, so we talked about medications, we talked about vaccinations, we talked about chronic health conditions, we talked about travel, and then talking to your employers, and then talking to family for their support. 2 people make a baby, right? Well, apart from the technological stuff that we talked about the other day, but generally 2 people make a baby. The onus is not just on the woman to make sure that these things are in place. I love that I have men on this forum because I like talking to you about these things. Making sure that you also have plans in place for how you're going to support your wife through this. As many plans as we can put into place, there are a lot of unknowns in pregnancy. Nobody knows how their body is going to respond to the different trimesters, and I'll address that a little later. So mentally and physically, it takes a huge toll on some women when they're going through a pregnancy. So the support of family, the support of friends comes in very handy. Don't wait for a woman to ask for help. Offer help if you can. Offer to, help them with meal prep. Offer to help them after the baby comes. Just put it out there for them so that they know that they can come to you if they need help. Offer to talk to them when they're feeling overwhelmed by in the different trimesters. And specifically for the partner, making sure that you guys are having conversations about your goals, your ideals, what you hope for the baby. Everything from, are you going to circumcise the baby? Are you going to name the baby? What, are you going to be there for the delivery? I've seen a lot of fathers very surprised at the last minute when we say, yes, you're going to go into the operating room with her. They're like, what? No, she can't go in there by herself. So just some realistic expectations. It's great if your partners can come with you for the visits. In this in this era of COVID, unfortunately, we're having to limit how many people are coming into the office for the visits. So a lot of offices are only having the patient come in, but that doesn't mean you can't FaceTime into the office. I would be hard pressed to find an OBGYN who would be opposed to a supportive partner FaceTiming into the visit so they can listen in as well to the advice that's being given or the conversation that's being had as well. All right, so those are some of the expectations and things that you can do prior to getting pregnant. One very important one that I left for the end is your prenatal vitamins. Prenatal vitamins, just by the name, are vitamins that you take before you get pregnant, prenatal. If you can start your prenatal vitamins at least 3 months before pregnancy, you probably get the most benefit out of them. In one of the prior discussions, I think it was the one about mature pregnancies, we talked about women who might need extra folic acid. So prenatal vitamins have a whole list of supplements and vitamins that are in there that are helpful for both mom and eventually for the baby. Women over the age of 35 are at higher risk for neural tube defects, so that's defects in the brain and the spinal column. So you need extra folic acid. Most prenatal vitamins will have anywhere between 400 and 800 micrograms of folic acid. For women over 35, you need 4 milligrams. So you need 10 times the amount. And again, you need this before the baby actually forms. So starting to take it prior to getting pregnant will actually help. Okay. All right. So those are some of the prenatal things we can do. And specifically talking about that also, I want to make sure I don't forget to mention folks with different dietary restrictions or different dietary ideals, I guess I'll use that word. And I'm talking about people who have had maybe a gastric bypass surgery, and so they have absorption issues where they're not able to absorb fully different vitamins and supplements. Making sure that you're in a good, you're talking to your GI doctor and making sure that you have a diet that's as well-rounded as possible. Also, vegetarians and people who are vegan may need to boost up their vitamin B12 because you don't do a lot of meat products. Sometimes you just need to make sure that your beans and legumes and your diet is as full as possible. I've seen people who go on rather extreme dietary causes, and I'm talking about people who will do like fasting for 48 hours and things like that to try to lose weight drastically. That's not something that can be maintained during a pregnancy. So just making sure that you're realistic about that. Okay. So you've done all these things. You've made sure that you've lost some weight. You've changed your medications around to safe medications for pregnancy. And with the chronic conditions, I only mentioned cardiology and hypertension, but we also have thyroid disease. We have diabetes. We have people who have seizures and are on different seizure medications. You obviously can't stop your seizure medications, but there are some that have a better safety profile for the pregnancy than others. So all these different things. In pregnancy, you are going to be what we call hypercoagulable. That means that you are at high risk for forming blood clots in pregnancy. The people that are worried about blood clots with birth control pills or hormonal medication, well, pregnancy is a hypercoagulable state as well. So it's a state in which you're at high risk for forming clots. This is why making sure that you're in a good health status helps that. Making sure that you're active during the course of that helps that. All right, so first trimester. This is the trimester that some women have some difficulty with. And it's because with the rapid changes in hormone levels, specifically progesterone levels, some women will feel very fatigued. They will have nausea, they will have vomiting, they will just, it's a heavy fatigue that is indescribable to some people. And for the support people around them, instead of, this is where you come into play, in helping them through this process, in understanding what they're going through and not saying things like, why are you sleeping so much? Why are you not doing anything? Why are the dishes not done? Do them yourself, okay? Do them and help them out, please. Okay, so there are things you can do during the first trimester to help some of these symptoms, not necessarily for health reasons, but just to help you make it through this phase. Something as simple as hard candy in your mouth, gum, eating small meals every 2 to 3 hours will sometimes help with the nausea, the vomiting. This is not necessarily for health. This is just to help you survive the first trimester. Making sure that you get an appointment with your OBGYN within the first trimester is very important, because this is when we're able to date your pregnancy. And a lot of decisions that come later on in the pregnancy are based on accurate dating of the pregnancy. And how do we do that? We do that by looking at when your last menstrual period was and by getting a first trimester ultrasound. And the earlier we're able to do this, the more accurate it is. We can do it in the second trimester, we can do it in the third trimester, but the first trimester is most accurate. In the first trimester, there can be a difference in accuracy of up to 5 days, which doesn't make much of an impact later on when we make decisions about your delivery. In the second trimester, if that's when you're coming in for your first visit, the dating can be off on ultrasound by up to 2 weeks. And that is pretty impactful if you end up dealing with things like high blood pressure or diabetes at the end of the pregnancy, because we make decisions about when you should deliver. And if we're off by a week or two, that could be impactful. Baby's lungs and how baby does when baby's delivered based on accurate dating. So making sure that you get an appointment with your OBGYN, if possible, somewhere between 6 to 10 weeks, so that accurate dating can be started, will be great. Let's see. What else in the first trimester? If you already have your exercise regimen, like I said, maintaining that, if you can, is fine. You don't have to, there are people who are not able to eat as much because of this nausea, vomiting, fatigue. Don't be hard on yourself. I think most people will not look at your weight gain during the first trimester and chastise you about it. Now, if you start losing weight because you're having intractable nausea, vomiting, meaning you can't stop throwing up all the time, yes, you need to let your OBGYN know as well. Sometimes you need IV fluids, you need IV supplements, you need IV medications to help that, because that can sometimes be detrimental. And the retching and all of that can cause you to have bleeding and spotting, which can be concerning as well. Thank you. I'm looking at some comments here. And for those of you who are joining now, please feel free to post your questions in there at the end of this. I always like to go back and look at the questions and make sure that I addressed all your questions. So how many times did I say questions? Okay, so yes, put your questions in the comments so that I can address them at the end of this. Okay, so first trimester, we can have nausea, we can have vomiting, we can have fatigue. We may or may not gain weight. If we're losing weight, we want to talk to our doctor about that, or have your family member call in for you. so that we can make sure that we're giving you anti-nausea medications or IV fluids, or giving you advice on things that you can do to help through the first trimester. Second trimester tends to be the trimester that people enjoy the most. And this is usually because all those symptoms that I mentioned in the first trimester have improved at this point. So you're able to enjoy your meals. The aversions to smells and tastes sometimes improves in this trimester. But this is also the trimester then that some people get carried away. You know, you hear the adage, you're eating for two. Well, you're really not eating for two. A developing baby does not have the same nutrition requirements as a grown adult. So you don't need to eat 2 portion sizes of food. That's not going to the baby. Actually, if you're pregnant with just one child, you only need about 300 extra calories a day for the developing baby. 3 extra calories, that's, if you look at the nutrition requirements on a lot of different products, that's like a half a sandwich, you know, and that's the only extra that you need along with your basic, nutrition needs prior to getting pregnant. So you don't need to eat for 2. You just need to increase your calories by 300 calories per day per each child you're pregnant with. So for example, if you're pregnant with twins, your nutritional needs are 600 extra calories a day. Triplets, 900 extra calories. That's still not even gotten to 1,000 calories a day. If you even look at the calorie count in, a burger from your favorite burger place, I won't say any names now to start any wars, but an extra burger a day is usually way more than 1,000 calories a day. So pace yourself there. And for the support people around, don't keep pushing food on the mother that's trying to be healthy as well. Don't say you're eating for 2, because they're really not. Okay. This is also where, if you were not able to be as active in the first trimester, you can probably implement some activity in this level. And again, you don't have to you don't have to be Serena, playing tennis tournaments while you're pregnant if you weren't doing that before. If you were, you can maintain that. And I won't say names, but I see someone on here who I'm smiling because I remember, her doing CrossFit through her pregnancy, and I was so impressed with that. But the requirements for exercise for all of us in our daily lives, not pregnant, but in our daily lives, is 150 minutes of moderate exercise per week. What does that mean? You can break that up however way you want to. You can do 3 days per week of a 50-minute brisk walk, or 30 minutes per, the weekday of a brisk walk. And a brisk walk means that you're breaking a bit of a sweat. You can still talk through it. You may not be able to sing a full song at the end of the walk, but you can physically see that your body went through some work. Your heart rate increases some. So doing that, and I will encourage people, if they say, I don't have time to do that, they say, once you pull up in the driveway at home, instead of going straight into the house, maybe do a quick lap in your neighborhood before you go in. Or if you're doing a quick run to the grocery store before you get home, either just before you do the groceries or right afterwards, do one quick lap around the grocery store. For those of us in areas where we don't have access to, places like this, there are definitely going to be neighborhoods everywhere that you guys are watching me from. There are areas where you can go for a quick walk around your neighborhood to just get your heart rate up a little bit. And doing that, you can break it up. You can do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, and do that 3 times. That's 30 minutes a day. Do that 5 times a week, and there's your daily requirement, your weekly requirements. All right, so second trimester, we want to try and maximize the fact that we're usually feeling better by doing these things. The importance of mental health during pregnancy cannot be undermined, like I said, and I will do a whole lecture on peripartum and postpartum depression that will be one of the things that I have on my list to do. But I'll just briefly say here that if there are stresses, making sure that you are being open with your doctor about this, because some physicians' offices, at least here in the United States, will have resources that can maybe help. We'll be able to refer you for counseling sessions, for therapy. We may have social workers available that we may be able to help with needs that you have. And don't see this as something negative. This is something to support you being able to be in the best mental and physical shape to nurture this life that's growing inside of you. It's very important. I don't care how strong you are. If there's something that's affecting you negatively during the pregnancy, you should be able to ask for help and not feel bad about it. That's what we're here for, is to help you through that. Okay, so second trimester, talked about exercise, talked about maximizing the fact that you're feeling better, you're not eating for two. All right, third trimester, this is where physically some people will start to have some manifestations of a growing child inside of them. So your dynamics do change. Oh, and let me mention that about the exercise. Even if you were somebody that exercised heavily prior to getting pregnant, remember that during the course of the pregnancy, your center of gravity changes, your posture changes. So just every time you're doing things that you were doing before, make sure that you reassess. Exercises that I personally think are great for pregnancy be things like yoga, Pilates, just because there's a reassessment of balance and there's a meditation aspect to it that can help both things, mental and physical as well. Okay, so third trimester, when the baby starts putting on more fat, and so you tend to have a more forward center of gravity. You can have physically pain in the low back, pain in the pelvic area. Just, it goes almost back to like the first trimester, and the fatigue is a different kind of fatigue. It's a physical fatigue. This is also another area where your family can support you. You may not be able to do all the things around the house, around work, so your family and your work colleagues can support you. You may not be able to do all the things that you were doing before. You may be moving at a little slower pace. Be kind to yourself. You're growing in life. Don't beat up on yourself about that. Be sure to ask for help if you need to. You can get maternity belts if you need to help lift the baby up and support your pelvis. Continue to try to be healthy in terms of how you're eating and making sure that you're not just sitting stagnant in one position, because remember I mentioned that pregnancy is hypercoagulable, so you're at high risk for blood clots. You still need to move, you just might need to move a little slower. Okay, so recapping it all, over 50% of people plan their pregnancies. If you have an unintended pregnancy, you may not be able to do some things to set you up well for the pregnancy, but if you did have a planned pregnancy, then you have an advantage there. Making sure you're taking your prenatal vitamins at least 3 months before you get pregnant. Making sure that you've got all your chronic medical conditions discussed with your doctor so that you're on the safest, maybe lowest possible dose of medication that you need to be on. Making sure that your medications are therapeutic, making sure that you have met with your primary care doctor, your specialist, so that during the course of the pregnancy, if any of these conditions worsen, your OBGYN can easily get a consult from the specialist that you were in as well, so that they can work together as a team to enhance your well-being during the pregnancy. Making sure that you surround yourself with support people that are going to be positive. You don't want negativity around you during the course of the pregnancy. So I encourage any of you who are around pregnant women, be kind to them. Make sure that you're offering assistance if you can. Don't promise and fail them. That's just not cool. But offer assistance if you can. If you're an employer and you have pregnant patients under you, making sure that you have certain things in place that'll help them out. help them be able to make their appointments, making sure that maybe you make tweaks to their job requirements so that they don't feel as bad if they're not able to do things that they were able to do before. One part that comes into play here is a full discussion on breastfeeding, for example. And I'm a huge proponent of breastfeeding, but I'm not as well versed in all the different aspects and supplements and all of that of it. I can do a modified talk maybe at some point on breastfeeding. I always think it's best if you get a lactation consultant to do some of the more nuanced things about it, but I'll do a general overview of breastfeeding later as well. But one thing that I find very beneficial is for employers, since I'm on that vein, is making sure that you have a space for your pregnant employees to be able to pump or breastfeed if possible. I didn't pay a lot of attention to this until I was pregnant myself. You know, when you're at an airport and you see a room set aside for breastfeeding, it's just a little thing, but it's so big. I mean, it's a tiny little room a lot of times, but it's very big. And so if you're in a position where you have employees and female employees who are of childbearing age, maybe doing some pre-planning to make sure that they have these kind of resources in place. For for the couples that are going through pregnancy together, having the talk about if the mom is going to be the one breastfeeding, how can dad still help? Okay, so she can breastfeed, but when she's done, maybe dad can burp the baby so that she can get some rest. This is where the co-parenting starts, you know. I'll go ahead and talk a little bit about the delivery room and how the support in that room also helps as the final piece of the pregnancy. I'm not sure if this is being done specifically in Ghana, and I probably should have done more research. I don't know a whole lot of OBGYNs in Ghana, so this is an area that if any of you know any OBGYNs in Ghana that I can pick their brains about certain things, please message me. I would love to share some of these ideas with. But I'm sure in the UK and in the United States, most places are allowing at least one support person in for deliveries. For the pregnant women, I want you to, or the pregnant women in your lives, need to choose a support person who will not be in there and distracted. Their attention needs to be on you. So I had a situation where I had to stop in the middle of pushing to turn to a dad and say, can you please get off your phone and help her? That this is not the time to be texting. You may have family members who are interested in what's going on in the room, but the primary attention should be on the woman who is delivering this child, who is going through this final piece of this beautiful journey. So if you're a support person in a room with a pregnant woman, making sure that in that moment, she is the center of attention. And she can't get up from the bed sometimes to go and get water for herself, to get this and that, making sure that you're doing those things. That's what you're there for as a support person. So that's something that I get a little passionate about. I have witnessed deliveries in Ghana, and I know that the conditions are a little different than from here, but I can't speak of the limited experience that I had there. I don't know if this is a general thing all around, but when I was there, I didn't see any support people in the room with the patients. So the situation may be a little different. You may just need to go in with more things to help yourself through the process with. Again, I'm not very well versed in that, so I can't talk too much about that. So I'll leave that part be. Okay, let me go through and see if there are any questions. I love this part. Let's see. Yay, yay, yay. Hello, hello, hello. And don't forget, if you're watching this live, please type in a hi, a hello. I like to come back and say thank you to you for watching. If you're watching this on replay, type hashtag replay. And if you have questions during the live, post them in the comments so that I can address them. If you have questions later on, still post them. I always try to come back to the videos to address them. Let's see. Hi, hi, hi. I see a lot of hellos. Okay, not too many questions today. Well-informed discussions always. Thank you. Thank you. Nice hair, Christy. You're funny. Thank you. Okay. Oh, wow. Okay, they like the hair. Thank you. Thank you. All right. I don't see. Hello, Dr. Love. Oh, hello, Dr. Love from Ghana. Hello. Okay, I don't see a lot of questions today. I'm not sure if that's because most of us have either had children already or are not currently in that space right now. I wondered about that for this particular talk. However, if you're already done with having all your children, or you are not in that space yet, you know a woman that is, I mean, the number of women that are pregnant in the world are just out there. So you have a cousin, a friend, a neighbor, somebody that is pregnant that's going through this. I hope at least what you get from this is making sure that you are sensitive to the needs of pregnant women, or you work with a pregnant woman. Making sure that you're sensitive to their needs, making sure that you can ask them how they're doing, making sure that you can share some of these resources with them. I'll spend a little more time, I guess, on the nutritional requirements during pregnancy, since there's not too many questions. The important things, other than just your prenatal vitamin and the folic acid that I mentioned before, are making sure, one of the common things that happens in pregnancy is anemia. So a lot of women start out sort of borderline anemic if you don't have a great nutritional regimen. So during the pregnancy, as I mentioned, you will gain about 50% more body fluid. So there's a dilutional effect already on your blood concentration. So it's common to get anemic, a little anemic, if you were borderline during the course of the pregnancy. And so around 26 to 28 weeks, your OBGYN should typically check again to see if you are anemic. And if you are, making sure that you're on a daily supplement of that, making sure that you're eating foods that are iron rich. So your green leafy vegetables, if you're a meat eater, your red meat. And they should recheck that. If not, you may get to a point where you need either an iron infusion or a blood transfusion prior to the pregnancy, because you know you're going to lose blood during the course of the pregnancy. Pregnancy also puts a lot of nutritional needs on our bodies as well. So calcium levels can be affected, your vitamin D level can be affected, and specifically in melaninated folks like us, it's interesting because we seem to have lower vitamin D stores. So making sure that your prenatal vitamin, if it doesn't have a vitamin D in it, which most should, that you're taking a vitamin D supplement as well. If your fatigue persists more than the first trimester, that's another area that you can maybe talk to your OBGYN about, maybe checking that. And vitamin D and calcium sometimes go hand in hand in terms of absorption. So making sure that your diet has dairy in it as well is important. I mentioned the vitamin B supplements. Those help with placenta development. The placenta supplies all the nutritional needs to the baby. So you need a good vitamin B support in your prenatal vitamins. And for our vegans and our folks that have gone through gastric bypass surgery and our vegetarians, making sure that you also have vitamin B12. If you don't get that from diet, then making sure that and from diet you can get it from your beans, your legumes, and whatnot. But making sure that you're getting a supplement for that. Let's see. Thank you. Good info. Pass it on to people we know. Plotting for more kids. Very useful. Hello. Thank you for your efforts. True. I'm done. Janet, are you sure? Janet? Okay. Very good information. All right. So there, I hope that you did find that useful, as you say you did. I hope breaking it down into the different trimesters was helpful as well. If you have questions about it's a very broad topic, so if you have any questions, even just peripherally related to it, just post them in there. I'll be happy to address them. Next week, I will want to go back to a GYN topic. I encourage you to send me your suggestions on topics that you want to hear me talk about. We've had a lecture on, well, I say lecture like I'm like giving a class, but we've had discussions on fibroids, on pregnancy in the mature years, on menopause. It was really that dreadful. On alternative ways to have a child. We've had a lecture now on maintaining a healthy pregnancy. So, and contraception, I forgot that. So we've had a topic on birth control options as well. So send me your topics. I'll be happy to join you again next Saturday at 11:30, same time, same place. I really, really appreciate you guys being here. For those of you who are joining for the first time, many of you know me, but for those who don't, I'm Dr. Benga, your board-certified osteopathic OBGYN. I am based in the United States, so a lot of my lectures are focused on what I'm exposed to, but I know that a lot of you are joining me from different places, so I try to make it relevant to everybody. The reason why I do this is I'm very passionate about women's health care. I'm very passionate about giving you the information so that we can demystify some of these myths that people have about things that the female body goes through. That way you can make healthcare decisions that are based on knowledge and can empower you to find your voice. So that's why I do this. I hope you find it beneficial. You can find me on all social media under Dr. Benga OBGYN. So that's DR for doctor. Benga is BANGA, and OBGYN. Thank you. Thank you. See ya.